Today we're going to talk about how to take care of your instrument. Now, some of you are on different levels, so we will have two different instruments going on to show you in both ways how to take care of it. Now, the first thing we're going to do is make sure you start with your cork grease, especially for those who have instruments that are newer. Now, this cork is dry. It's a bit lighter, on the lighter side. So we're going to apply to all corks, every cork you see in your case. Apply, just like chapstick. You can do it generously. Apply your cork grease. Remember, it's cork grease, not slide grease or nothing other than that, on that cork. And if your corks are having some issues fitting into the other parts, you can rub it in with your fingers. Now, you may need to do that a couple of times. Now, for the mini instrument, I'm going to grab this here. After playing, you have to swab the instrument because we get a lot of condensation in there and we don't want things growing because that's not very nice for your instrument, especially when it gets to the keys. It can kind of clog some stuff and cause some deterioration on your pads. So before you swab, you always take off your mouthpiece, barrel, reed. So this top part is going to come off. We're never going to run our swab through this part. So you can set that aside. And you're going to flip your instrument down. Why? There's a post inside of your clarinet in the upper joint that swabs like to get caught on. Now, your instrument may have come with a different type of swab. You need a silk swab. It can't be cloth or just like cotton swabs. You don't want any other type of swab except for silk because they will get stuck and it's not fun to get them unstuck. So you'll have a little weight at the end. Remember, instrument's upside down. Put your swab down the middle and you'll see it come out the other end and pull slowly through. Careful not to get it stuck on these side keys. Remember, we talked about them being delicate and this bridge key is delicate as well. Pull it through. If it gets a little stuck, just pull a little bit, pull. Never try to go the opposite direction. So if it gets stuck, never try to go back here and pull it out. It's not going to work. It's going to get more stuck. Okay, so that's for the mini clarinet. I'm gonna put this together real quick. Now we're gonna move on to the full-size clarinet. When we're playing for a while and you're with your right and left hand on the instrument, the condensation will come all the way down. Remember, taking off the reed, the barrel, or the mouthpiece, and the ligature, the barrel stays on. Set that aside. Your case on the floor. And grab your swab. Flip your instrument upside down, and remember, grab it by somewhere that doesn't have a lot of keys. Yes, you will touch keys, but you want to touch the less amount as possible, or the least amount as possible. All right, now upside down, you stick the weight in and feed it through, and slowly bring it through. And you could do this a few times, like if you've been playing a very long time, you can run it through as many times as you need. And you'll notice that this swab does get wet. So make sure that it's catching everything. And if it's getting stuck, remember, don't try to take it out the opposite direction. Keep pulling little bits at a time and it won't get stuck. If you have one of those cloth swabs, they will. So make sure that you're not tugging those through and not using those at all because they are not fun to get unstuck later on. In the event they do, you just take it apart. Remember, you're pushing down this, take it apart, and you'll see the swab halfway through and you'll be able to pull it out. Alrighty, and that's pretty much it for cleaning on a daily basis. For your mouthpiece, you can clean it with a soft toothbrush. You don't want to do like a medium or hard toothbrush to clean your mouthpiece. Toothpaste is not bad for the mouthpiece, but we typically don't use it. There's this special mouthpiece spray you can use. Really, that should only be done maybe every few months or if you've been sick. But a soft toothbrush, warm water, but make sure that these little corks do not get wet. So you'll have to hold it like this on the side and hold it kind of upside down. We can't get that cork wet because it'll swell and probably misshape. And that's all there is to keeping your clarinet nice and clean.